and turn it to Kathy to introduce, or excuse me, to welcome everybody.
Okay, so I'm excited about this one. So welcome everyone on behalf of NAMI, Yavapai, and the Northern Arizona Parent Family Coalition.
All right, thank you, Kathy. Um, I would like to introduce everybody that's on the panel this morning. Tamara Player is not able to be here today. Something came up last minute that needed her attention. So apologies, and we're sorry that she's not here today. But we do have the one and only Trish Reiner. You might see on the pictures on the Zoom, we've got a couple of people seated at the table. They are at the Family Involvement Center in Prescott Valley. Trish, if you want to raise your hand, then people can see which one of there's Trish. Okay, Trish is a parent of three children whose oldest son began receiving behavioral health services shortly after moving to Arizona in 1999. With personal experience navigating residential treatment centers and the Arizona State Hospital placements, she understands the challenges that families face when their child transitions between placements in and out of the home. Trish has developed advocacy skills that she shares and models for other parents and caregivers who are currently living in a similar journey. And Trish, if you'd like to share with us what your role is with Family Involvement Center and anything else that I didn't share.
Um, at Family Involvement Center, I'm also the regional director for the North and the South, overseeing our parent, peer, and youth services in those areas.
All right, thank you. And we have at the table with Trish, Denise Reed. Denise, if you'd raise your hand. Thank you. So here's Denise. Denise is a single mom of two girls. One has AUDHD, and the other has a genetic disorder which led to developmental delays. Denise shared, I am just trying to navigate life as it goes. It's a new day every day with them. We are receiving support through Family Involvement Center to help me be better prepared for each day. Would you like to add anything to that, or just as the program unfolds, Denise?
Just as the program unfolds.
Okay, all right. And we also have at the table sitting between Denise and Trish, Teresa, if you'd like to, there you go, raise your hand. Teresa Whitley is the mother of four children, one with special needs, one with serious mental illness, and she is raising her teen grandson who has had behavioral challenges. Teresa has participated in a family support off and on through decades of extreme hardship. She's found Family Involvement Center to be an invaluable asset with parent peers who understand significant struggles without judgment and provide support on a level that others can't. Would you like to add anything to that or just as we go in the program? Okay. Next, I'd like to introduce Karaya. Okay, now I got your first name right. Arasim?
Arisim. You're
Arasim.
good, Lori.
Okay. One of these days I'm going to get it right. She is the director of adult services at Spectrum, where she oversees, hang on. She, where she oversees adult, outpatient, and crisis programming. With over 4 years of experience in community mental health, she previously worked extensively across the state, providing in-home therapy for both children and adults. Pariah is deeply passionate about expanding access to care and strengthening the communities that she serves. Would you like to add anything to that?
Nope, I'm good. We'll talk more through the programming, I'm sure.
Okay. Right. Um, Next, I'd like to introduce, last but not least, Terry Holloway. She's the Access OIFA Healthcare Advocacy Coordinator. The mother of 7 children and 8 grandchildren, she has over 20 years of utilizing her lived experience in supporting other families and navigating various child and adult serving systems. She has helped create family support training curricula and train individuals delivering family support services. Terry is a peer and recovery support specialist, credentialed family support partner, and certified in intentional peer support. Terry, would you like to add anything to that or just as the program goes?
Nothing else to add. Thank you.
Okay. Terry, we're having a hard time seeing your face. It is shadowed. I don't know if you can change the lighting in your room, but you're kind of a silhouette for us.
Okay, I will try to fix that.
Okay, all right. So, our topic today is access covered support services and family members of adult and youth. Our panel members are going to share their knowledge, their experience, and perspectives on this topic. Now I'm going to toss the hot potato to anyone on the panel who would like to lead and just share a little bit about your experience. Are you aware of family support through the clinic? If you are, how did you find out about it? Or if you're not, we'd like to know about that too.
Found out about family support services through counseling at the local mental health facilities for my kids when I signed this up through our trying to be from terrible things that were going on in the household. We get counseling, and they'd say, would you like some support services? And I had no idea what peer support was at all. And that's how I was introduced to it. They signed me up for it. Years later now, in between my first family of 4 children and now with my grandson, I remember thinking, I don't want counseling, but I want peer support. And I would come in and say, no, you have to go through counseling first, or through the agencies, and then they could sign you up with FIC. But I already had experience with FIC, and I knew exactly what I needed, and it wasn't counseling. It was a peer support. It's so important.
So Teresa, it sounds like there was a gap. You had initially utilized FIC with your kids, and you found out about it from the counselor at the Community Behavioral Health Center. And then some years went by and you went back and asked for it, or you got a new counselor for your grandson. Did the agency at that time also bring it up, or did you because you already knew? Who initiated it? You did. Okay.
I did.
All right. Well, thank you. And Terry, we can see you now. Thank you for making that adjustment. Who'd like to go next?
I can
Denise,
go next. Oh,
okay, go ahead. I'm sorry.
no, no worries. That's always that awkward silence, right? Like, who goes next? So I very, very, very first learned about family support back in the early 2000s, right? So my family was facing a lot of things that were happening that were really, really difficult. I had my children in counseling, actually with a New Leaf, used to be prehab. We were with a counselor who had said to me, Terry, I think you'd make a great family support partner. I had absolutely no idea what that was, but she told me it was 9 to 5, and I was super excited, like, yay, no weekends. I was working as a photographer at the time. And she lied because it wasn't, but it was okay because I fell in love with it right away, and it worked out well. But I was able to not only learn about family support, from the professional side of things, but more importantly, receive family support from places like the Family Involvement Center. And also Prehab had hired. In fact, I was in the same hiring class as my family support partner, Margie Kelly, back in the day, who was absolutely amazing. So that's how I learned about family support right in the beginning. I will tell you that we're raising a second generation. So we have a 8-year-old and a 5-year-old now. And I will tell you that it is a little harder to get family support now, not only for my adult son who's in the SMI system that I've been trying off and on for years to get some support with, but also for our 2 little ones. When I'll ask, and the clinic that we're with right now just says we don't do family support, and then kind of trying to get it from the outside had been hard. We did eventually connect with Family Involvement Center because I knew, that I knew how to do that, and we have some support now with them.
Terry, you're with Access and you've utilized these services and supports. When we say family support, can you share with everyone who provides family support? Is it the case manager? Is it obviously it's FIC or a peer run or a family credentialed family run? So I'm hearing that both the community behavioral health and
Hello.
specialty. Like I need to mute somebody here. Sorry about that.
No worries. So, good question. So, essentially, case managers and the public behavioral health system do provide some level of family support, which looks different than peer parent delivered family support. So, when we're talking about credentialed or peer parent delivered family support, we're looking at someone who has walked in similar shoes as you have as a parent and can share those similar experiences with you and provide that support, resources in the community that they've probably used themselves, kind of tried and true, helping you through those tough times that you're going through, or celebrating the good times, but doing that, side by side, really helping to increase a person's ability to have a voice. I can tell you, when I came into this, I had no voice. I was afraid to talk to anybody. And there are people in this room that probably know that very well. And I, over the years of being next to people who showed me how important it was to be at the table for my children, to have a voice for them, was able to do that. So that's basically how family support works. In a nutshell. It can be a little more complicated than that, but that.
Thank you, Terry. So, Karaya, you are with a community behavioral health provider, so you can share better than maybe some. What does that look like when we say family support for either an adult or a youth? I know with an adult, you're going to have the person receiving services sign an ROI, give permission, and ask for the service. And with the youth, you've got the parent who's whoever is the guardian. So how is it offered, and what does it look like?
Great question. So we try to make it as easy as possible for those that need it and are identified as needing it to get access to the service. We do offer it annually. So at every reassessment that's completed, we offer, make sure that they know that that's an option, whether they feel like they need it right now or not. We want to make sure they have that support. So that's right then and there in that annual or intake, we say, hey, we do have the option of family or peer support, depending on the age ranges again. We give some clarification on what that service looks like. And we always let them know that it's always on the table, right? Like you don't have to be in crisis to be accessing the service. So we have that conversation right at the get up and the intake or in the reassessment, so yearly at least. But then throughout treatment, we have further conversation, especially as things come up, right? So when we're in our CFTs for children's or adult recovery team meetings for adults, we're talking through what the need might be that's causing some escalation of behaviors or maybe symptoms or just that feeling of needing support, right? There's tougher moments and tougher months for sure, depending on the seasons and what's going on. So we have those conversations, we offer the service, and then depending on what we have in house, so I can tell you with Spectrum, we have peer support. Family support's a bit tougher. So as Terry had said, that care managers can to a certain degree offer that service, but they're not certified. So they don't have that certification or their ability to say for sure that they're offering that certified family support service. But we do have resources like FIC or elsewhere in the state that we provide referrals for. So again, as Lori said, we have them sign an ROI, we coordinate care, we invite them to the ongoing meetings, whether it's art meetings or CFTs, whether it's children or adults. As I mentioned, Spectrum does have in-house peer support. Our in-person right now is in Central Arizona, but in Northern Arizona, we're offering virtual while we're trying to fill that space. We did just recently lose our peer support. She's going off to better things, but we were very sad to see her go. Just because again, we love having that ability to say, I can have somebody come meet you, see you. The virtual I know works for some people very well, and sometimes that's an easier service to access. They say, I don't want to leave my house or I don't want anybody coming to me, but I do want that support, whether it's again the family or the client themselves. But we try to make it as easy as possible to access that service and talk through what it realistically looks like. I'm really clear with my teams and saying, hey, it doesn't have to look like a traditional coming into an office and getting served, right? Like this could be somebody coming to you in your home or meeting you in the community, or again, offering that phone or virtual if that's more comfortable for you. So really just clarifying what that service modality needs to look like and what they can offer. It's more than just a listening ear. It can be that hand over hand support. It can be the advocating or the offering them opportunities and places to advocate for themselves too, teaching that skill.
Thank you. Thank you. Denise, with your experience receiving support, is this something that you learned about from the community behavioral health provider, or how did you come into it?
I learned what it was because I applied for a job here a few years ago. And then, my daughter's counselor signed us up. She sent a referral and now I have peer support.
Is it something that you initiated, or did your daughter's counselor advise you? Or did you just, because you knew about it, did you ask for it or did she offer it? Or he?
Well, she asked me if I needed any extra support, and I asked her as much as I could get.
Good for you.
Both of my kids were not in a good situation, and I know I needed help, so I asked.
Okay.
And then she sent the referral, and it got set up really quick.
Mm-hmm. Mm-hmm.
And it's been really good for me.
All right. Does anybody have any questions so far with anything you've heard already for anybody? Or your own experience that you'd like to share?
I'd like to add that that one time that I sought out FIC before I had counseling, it wasn't just one time. I knew that I needed an extra person to help me with all the balls I was juggling, more than I needed to get set up with the counseling service. I just wanted to get the ball rolling because the problems were so severe. It was more than one person could handle. It's just nice to have someone help my focus come in. And I knew what I needed as a parent, but I wasn't capable of doing it all on my own. And I just struggled with the amount of time that going through the counseling service was taking. It felt like it was taking. I know that they're offering services, but trying to keep my eye on the let's see, my thoughts. When I say try to keep my eye on the main ball, that's a problem because there was too many main balls that needed addressing immediately, and I just needed someone to help the focus on each issue and keep my brain organized. It wasn't a counseling issue. I knew what needed to be done. I just didn't have. Well, that's not true. I didn't know exactly. I needed someone to make suggestions and someone to say, we could do this, we could do that, and I can help you with this. This I can't help you with, but let's research it and find out what help we can get you with it. And I knew that from the past, I've known Trish, I think so when they first opened this place. I think so, back in the 90s. Yeah, it was either late 90s or early 2000s. It's been a long, and they were just so helpful back then with what I needed, and then what I needed again, and then again. But I would have to spend time making appointments with other services before I could get into FIC to have the peer support that I'm receiving right now. So I just wanted to add that. But I've come several times and they said, no, you have to go. You have to go to counseling, or you have to go to the facilities. Whether it was, gosh, what was the name of it? I have it all on my phone. I've gone to all of the. I've been with Spectrum. I've been with Polaris when it was West Java Pike Guidance Clinic. I've been with, what's the name? CFSS.
Mm-hmm.
And anyway, I kind of lost my train of thought. So I'll have to stop.
Something caught my attention. You said you had to go through some hoops to get the referral to FIC. Were you being required to attend counseling and specific services first with the community behavioral health clinic?
When I came in and I spoke with Trish, said I need some peer support. We have to go through the proper. You have to go to one of those first before you can to get the referral. It's kind of like if you want. Yes, I had to get a referral from the counseling services to get peer support. I cannot just walk in the door and say, even if I was a past recipient of the services, I had to reapply or put myself back in with an organization, counseling services. I don't know.
So it sounds like maybe you had to get the service on the treatment plan as requirement. I see Karaya nodding her head, and Terry. So maybe helping some of us understand criteria from the what are the hoops people need to jump through? Because when we come into the system, it can be so overwhelming, and getting a lot of information and not understanding, and then how long it takes, and there's staffing shortages today in today's world. Karaya, Terry, you want to add, put anything input on that, or Kathy, you have any questions?
Would love to add to that. I think I recognize that feeling and being a barrier to a certain degree, right? Like I have a need. I've used the service in the past. Why can't I just get it right away? And I think the reason and the hope is that if you're getting enrolled with an outpatient service, whether it's Spectrum, Polaris, Southwest, like wherever, CFSS, I know you named a few, the idea is that peer support is one of the many services to wrap support around you and the family. So the idea is that we want to make sure that, hey, you're getting your needs met. So peer support is definite. We offer that from the start, but we also want to make sure if you are needing therapy and counseling, we're able to get you connected. If there needs to be some medication stabilization, we're getting you connected all under one house in that wraparound care kind of model. Peer support can be the very first referral, again, at Spectrum. At the intake, when you first start services, we have that conversation. This is a service that's offered. Would you like this service? We can put in a referral if we don't have it in home. And we try to get it on the treatment plan right then and there. As soon as you leave that intake appointment, you have it on the treatment plan and hopefully have an appointment or a referral sent out that day. If not, an appointment already sat in the books. But it is an idea that it's a part of the many services you'd be receiving to give you that support that you need to get your needs met or your family's needs met. So that's, I could see 100% that this has been a barrier in that, like, I know I need the service. I know exactly where to go, right? Like, why can't I just get it started right away? Well, there is a few more things that we want to make sure that we're addressing, and we're also getting it a treatment plan goal added so we know what we're working towards with this service, whether it's in conjunction or standalone. We want to make sure that we have some measures to make sure that we're meeting your goals or meeting your needs. And we're constantly talking about how that evolves over time.
So I have a question, Lori. So this is Kathy Bescher, and I don't know how to ask this in the perfect way, but we have watched very closely, especially with Spectrum and Polera, the referrals to FIC and to for peer support. And historically the model was keep everything in-house, don't refer out. And there is still some of that difficulty. You mentioned you had one peer support. So I thought you were with Hope, and is that just an adjunct? So you don't have any, I have several questions here. So do you have peer support available, and do you refer to Hope? And the second is there more collaboration between Spectrum now that you're under new leadership? Because we're really keeping an eye on this, because peer support and family support are so important, and we just have not seen much of it in Yavapai County. So what is your agency planning to do about this?
Great question, Kathy. And I'd say yes to all of the above first. We do have, and we are hiring actively right now, a few different peer supports in Yavapai County. So that is an open application. If anybody's interested, please visit our website. But on the other end of that, that's in-house. We also have that collaboration with Hope Inc. So they are kind of an adjunct. We collaborate with them. They are not under Spectrum's window, but they are working with Spectrum, and we even have them in our offices. So we have that direct referral that we can place over to Hope Inc. We also complete referrals across the board to the other agencies that it's offered with. We're through Unite Us, so we throw them out there whenever we have that need for a referral. If we can't meet that need in-house, we'll put it out there to the other agencies that offer it.
I think that's where I get confused, because you say if you can't meet the needs in-house. So the in-house services are very different than what you refer out. And when you refer out, it's a different kind of counseling. It's done by people that have had the shared experience. And that seems to be part of the issue, is the referring out and to actually secure that. So I'm wondering with FIC, how much difficulty, like the lady that, I'm sorry, that you said you asked for a referral. So you went to, did you have problems when you asked for that referral from your counseling agency or to FIC? Sorry.
No, I
So you did not have problems.
Did you have a problem getting?
No, I did not have a problem, but I did get hit with what others, and I don't mind this, but being in the system so long, when I went in the second, third, fourth time, however many times I needed FIC, I still had to hear how many other services, would you like this service and this service? I thought, no, I just need to get a peer support so I can get my brain organized, because like I said, I know what needed to be done. I just couldn't do it alone. I did not need to, I just want to be honest. I hope it's not offensive sounding, but it feels like when you go in for the counseling, it's almost like a commercial. Can I give you this and give you this and give you this? It's like, no, I know what I want. I need peer support. I just want to take care of my family. Gosh, I don't know if I'm saying this properly.
So that's
I
perfect.
I appreciate all the services that I get through counseling, but I'm on a roll to get, there's so much in the household that needs to be taken care of without problems, but when you start getting tremendous problems, a daughter with autism, a daughter with schizophrenia. The other two children I didn't mention, but they were both diagnosed ADHD, and they had a lot of problems that needed addressing, but they were kind of backburnered because of the other two. And then my grandson that I have now had such trauma issues being born from my daughter with schizophrenia and all the abusive people that were in his life pre me. I knew there were so many things.
That's what I really admire. I really admire you for having the courage and tenacity. I have a picture of your hooves out, your little legs, and you're just not going to go, because that's part of the problem when they offer all these services that you know what you want, and that doesn't sound like it was respected. And I wonder if it's cheaper for these providers to offer these services in-house. And the difficulty, I mean, that's a shame that had to happen to you. And I'm just wondering, is that widespread? And it's great that we're getting all these services offered, but when do they listen to what we want?
Exhausting. It's exhausting because you have to complete so many goals to get what you need to get your kids help and your household help, and to where you're not losing your home. Because I've been in that. In fact, that's one of the positions. I was homeless, gosh, a couple of times, but I was homeless with the one in the middle. I was living with my ex-husband because I did not have a place to live, a spare room in his house. I had my grandson I had just adopted who had severe behavioral issues to the point where I've been physically harmed and by a small child. And then my ex-husband had my daughter, my grandchild's biological mother, moved back into the house, so I could not stay there because it's horrible and too much. So you can see I'm already getting, so I need help getting into this apartment that took me a year and a half to get into the waiting list. And I had problems with that. I walked in here not having counseling service because I was in between. And what happened? I said, I need a peer support. I need to make this call now. Luckily, Jessica was here. And she said, let's just make this call. Or you can make the call here. And she just started writing down bullet points. I did all the talking, but I don't want to get anybody in trouble. And she said, at the end of this, said, if you want the peer support, you have to go back to whatever place and have them recommend family involvement centers so you could have peer support. But at that one time, I was homeless and I needed to
That's the last thing you needed.
Yeah, and so it's more appointments, and I don't want more, but I just want to get home over my head and feel safe with this child, away from my ex-alcoholic husband with a lot of controlling issues. And then my daughter with schizophrenia, where nothing makes sense anymore because she's insane. And insane is holding the reins of my stagecoach, and we're going off willy-nilly because she's in control at this point, and I'm not, because crazy takes over. And I'm sorry for being offensive. Any of those words are offensive.
What you've done is you've articulated a major problem with the system. And in the middle of all your anguish, you've been able to share, maybe opening up the door so others don't have the trauma that you've had in getting the service.
And I think, Kathy, I can add now. So prior before when Teresa came to us, we were still, the system was still working that way. So people can now come and get fixed services for their kids without being connected to a behavioral health home. We do like that if they are connected to get a referral, because we find when we do our own intakes, we are separate from the behavioral health home, and the lack of communication there, it helps us build a better, stronger team, I think, when we're all working together. So that is one thing that has changed, that people can come and get parent peer support. They would still have to do an intake with us. But we can do that now where we could not do that previously. And we still do get lots of families that come in that have never heard of us. Maybe they're up in the middle of the night, on the internet. That's how they found us. And so we do, parents are still feeling, I think, like they're out there on their own trying to find those resources.
Trish, you still have a person that goes into one of the providers and they know what they want, and they're being offered all these different services, and they just want to be referred to FIC. And there's so many barriers to get there. They can't just go, if they even know about FIC.
Right. Yeah, and I think that's the harder part to me, because we would much rather prefer to get support, or to be able to support families more at the beginning of their journey. We get a lot of maybe referrals when parents are maybe where Teresa was, where they're really in crisis. There's a lot of things going on, and you're having to share your story with this person, and then this person, and this person, and then, so all of those pieces, it does make it very hard. We definitely don't want to wait for crisis. We want to help folks prior to that, just understand what the system can offer, what services they can ask for, before we get to looking at a residential, or any of those would be, more ideal, because they have all that trauma.
Is this confused by access mandates, or are the providers taking these mandates and interpreting them the way they want? Sorry.
Sure, I waited 6 years.
Go ahead, Denise.
I waited 6 years for somebody to offer family support outside. I did jump through all the hoops. I did go through all the programs and services they offered. And if I had started here, I would not be in the situation I am now. I would be a lot more focused, I would have been able to juggle the kids and all the appointments and everything that they needed, because I would be more focused. So trying to go from chaos to focus is a big change. But she has been helping me a lot, and I've been signed off of places. CFSS signed us off and said we were okay. While my kid is having major issues, we got signed off on. And then we went to another place, and because they didn't have children services, we got signed off from them. We've gone through probably 10 different people, and I finally am now getting ahead.
Well, I respect that. Admire you. Keep it up.
That says a lot about the importance of prevention and getting in front of a situation rather than waiting to react when it hits the crisis level. Trish, you mentioned, or it was Kathy maybe asked about criteria. Are the criteria that access sets a part of the barrier? Teresa, what are those criteria?
Okay, I thought you were talking to Trish, so can you?
Oh, I'm sorry, Terry. I'm sorry. Yeah, Terry or Karaya or Trish, what are the criteria that access mandates? You're on mute, Terry.
Sorry. So It's interesting that you asked that in regards to family support. So there does have to be a health home involved, right? In order to get that initial referral out. That's the way it's set up. So, or right now, like Trish said, you can do the open door, but you still have to have a health home unless that's changed. Has that changed, Trish? Because as far as I know, you have to have a health home.
Talk to.
I'm
So
sorry.
I think it depends on different health plans that maybe still have some of that. We are being told that you can go, that people can go anywhere, you know, but I don't know if all the health plans still view that. I know in the past that was different.
Can they come to you, Trisha, now without having a provider?
Yes,
They can.
we will do it. We will do an intake with a family or with a child if they are not connected to a behavioral health home. And then when we get in there, we will encourage them if they have other needs, any medications, anything like that, maybe some more wraparound services. We will encourage them, but they still are in the driver's seat and getting to
Right.
choose what they feel is best for their family.
Okay, that makes sense. And so it sounds like it's kind of up to the health plans as to whether they allow that more of a streamlined plan or not. And I would say that I don't have a lot of experience with that sitting in this seat in Access. I haven't heard, but I do know that we are really working together with everybody to try to make it as easy and streamlined as possible. Because, like we just heard, having all of those barriers of knowing what you need and not being able to get it either discourages you altogether. So, we have families that are sitting here that weathered through the storm. How many families didn't weather the storm? How many just gave up and went away? And I can tell you that it has been like that for me on the adult side. I'd like to say I'm a pretty good advocate for myself, but I have not had any success in getting adult family support. I have a son who has schizophrenia, and has for many years has endured a lot of trauma, lots of different things. And in order to get adults, first of all, if they even know what it is, right? Second of all, if they have it, trying to get it. And then there is also the additional issue with that, my son would have to sign a release of information. And I can tell you that he always has. So he'll tell me, Mom, I signed it. Mom, I signed it. And then they'll say, he didn't sign it. He didn't sign it. And so it's just this huge thing that makes it really hard and a barrier. So the more we can knock down those barriers, and the real heroes are the people that are sitting around the table at Family Involvement Center who have done that work to say, this is what my family needs. This is what I expect. And that's how we start to break down those barriers. But we should be able to do it in a way that doesn't put people in that situation.
Thank you, Terry. Andrea.
Hi, good morning, everyone. I am questioning from a provider of services point of view going into integrated healthcare. I would like to know, as far as from a PCP perspective, referring a family within the system of the integrated healthcare system I'm creating, how does that referral process look? Would we still have to go through to apply or to get with a health home? Can we do our direct referrals directly to our families that are on our roster? So we're looking to incorporate an integrated system. So how would that look?
So you're talking about from the primary care, but to address behavioral health?
Yes, an integrated healthcare system that will be supporting behavioral health. peer support, would the process still be the same? Because I'm getting told two different stories, and I think it's kind of a gray area, even listening here. What is the requirement for a physician who is a PCP, who has a roster of families that would like to have these services? Do we have to go through the process of going through the home health or a health home portal as a pivot to be able to supply these services to our families?
You know, it sounds like you could send them directly to FIC, for example, and then FIC would do the coordination with the behavioral health home. From what Trish was saying, you know, with the open door. But and you're talking about a primary care that is not affiliated with a health home, like Spectrum has integrated care. They have their docs, but you're talking about someone outside of that community behavioral health. So I'm just looking for clarity on that so we can get some answers here.
Lori, I can add to that. So we did a few years back, we partnered with one of our pediatrician offices here locally. We met with them. They shared some of their concerns, challenges that they had, sending parents directly over to behavioral health homes, how we could be different. And so we had some really good dialogue with them about sending over families to us as long as they were on access, because most of our services are under access. Then we would reach out to the families and do our own intake and get them connected to a behavioral health home. That way we could help them from that very beginning process of, you know, go with them with the intake. We can help them get that scheduled. We had a couple behavioral health homes that were really worked well with us, where we could call them and just get them on the schedule to get them in sooner, instead of having them wait and callbacks and all of that. So we did have that for a while that we were able to do, and that seemed to work well for some families and not doing it all on their own.
And Tricia, you can start the services before you have the treatment plan from the health home and bill for it, correct?
Yeah, we will do our own assessment as well as our own support plan in those cases. And we can share those we're also outpatient licensed. We're just not a behavioral health home. We're specialty provider. So we can send those documents if they wanted them over at the behavioral health home. They usually want to do their own. They don't want ours, but we are able to do that.
And then for the health plan that requires the connection with the behavioral health home, is there a time frame that they have to get that assessment and treatment plan to you that they have done for you to continue billing access for the service?
That I'm not sure what the requirement is. We will continue to request documents over and over. It's helpful if we know families want the service, because then we can help advocate on their behalf to get everything that we need to continue services and not stop.
Go ahead,
Tricia,
Karen. Oh, sorry.
I'm sorry, go ahead.
I thought you unmuted.
I was just gonna clarify. So it sounds like Trish and Fick act as the health home. So they are outpatient. You guys are the health home. You are the ones that are navigating referrals to further agencies if they need, I'm hearing, like counseling or psychiatry or services that you can't provide. So in a way, you guys are acting as that health home, that it's an open door. If they're coming in, they're getting that service right away. And then you guys are the hub of coordinating care. So it wouldn't be that Spectrum would then become a health home. It would be more so that you guys would say, hey, I've met with you. Yes, let's get you some support. But it sounds like you could also benefit from these services. So let's put referrals out for these services. So it's in a way, it's getting rid of that. You must go to a specific health home first. They're coming to you, you're housing their services, and then you're putting out specialty referrals. That's what I'm understanding and helping clarify that barrier.
Yes, we can do that. We do encourage them to be with behavioral health home just for, you know, having other people, especially for kids that have more complex needs, and we get more families that have kids with complex needs. So we do that we would, if they get enrolled in a behavioral health home, we do then go to the behavioral health home and ask for a referral packet, and then we still start coordinating care. So say Spectrum, if they went to Spectrum, they would still be the behavioral health home because we are considered specialty provider in that sense. So, but then we would work together with them.
So Trish, is it working better? We've been at this for how many years? And is it getting better?
I'm going to say no.
Why?
I think I'm sorry that I think what I personally have really seen is a very big shift in how parents are viewed in the system at their behavioral health homes. And so parents, I don't feel, are not looked at as the experts in their kids' needs anymore. The system knows. If the system or the agency doesn't agree or doesn't like their parent, then they may just close them out, tell them they're good, and send them on their way. So the hard part for us is finding families, letting families know we're there, and still trying to build those relationships with behavioral health homes, because we're all there to work together. But I think that is the biggest challenge. And like I said, we mostly have families that have kids that have some pretty big complex needs. And and I think some behavioral health homes have a hard time working with some of the families. We've had people leave in the middle of a crisis saying, we've already told you how to deal with this, so I'm leaving in the middle of a crisis. They've left a parent locked herself in a bathroom, who said, please call crisis. They said, I got to go. We've already told you how to handle this.
So years ago, when I was with Access, we would do surprise chart audits. And so I was part of a little team, and we'd go to a provider and demand randomized charts. And what we found in those charts was a lot of talk about parents and labeling parents as borderline, overprotective, very, very negative stuff about parents. And I'm wondering if it stopped for a while, and I'm wondering if that has started again, and if it's allowed. And I'm asking Terry, maybe you should institute some little chart audits and just see what's going on.
Yeah, I got my list of every provider note from every provider visit, and a lot of it was about me. And well, I brought it in for her so I could get my kid's diagnosis and the medication sheet, because that's what was needed. And yeah, I was going through it, and a lot of the notes were about me. Like, I'm there for her. I want to help her in every way I can. So why are you dismissing me?
Well, because you're demanding services.
And I actually want to help my child.
Right. Yeah, I'll say I've not seen any notes. I've not asked for them, but I have felt the judgment from these places. That's something I've never felt at FIC, was judgment. But when I've gone to counseling, in fact, I've not only felt it from counselors. If we had a disagreement, then I've had to go up the chain and had to do a panel discussion when there was a disagreement with the counselor. And then I've had judgment from some of the panel and not from the others, but I never felt that during those panels, that I had the support of any of those counselors in that panel. And I felt like I felt on the defensive, and I'm there to help my children. I'm not there to make them feel like they're doing a good job. I'm there to help my kids, and I did not have the support. I had judgment.
I do think, Kathy, it did get better. I mean, I did see a really great, great support, at least back when they were rolling out the child and family team. We had West Yavapai, Kent Mattern was over there at the time, who fully embraced that, was willing to have family support on treatment plan. I mean, there were some clinics that really embraced that. CFSS was also a really great one that did a lot of those trainings for us. And I did see a great positive shift in the system, although there were still things to work out. But I do feel like we've kind of moved out of that direction and gone back to maybe the kids might be the ones in the driver's seats even when they're younger, and they get to determine what they want, or the clinic, and not necessarily what the family feels.
So you're saying that someone in the clinic, through training and being very supportive of listening to the parents and empowering them, made all the difference. And so I think we should be asking Spectrum, can you institute something like that?
Well, I'll say first, I'm saddened to hear about some of these experiences, and I can speak for the time I've been over at least adult services, how things are handled and how we communicate, and I guess what's the word I want to go with? Focus on the strengths-based portion of the family, the parents, the advocates, the natural supports in the client's life, whether it's adult or child. I guess I'll say it this way. There's a way things should be, and there's a way that like we've made it clear that our goals are. So again, that is the strengths based, the parent and the children and the family leading. Like that's at the start of our treatment planning is the family goal. That's created by the family, owned by the family, and maintained by the family, with the idea of the care team being the support to make sure that goal is met. I'm saddened to hear that hasn't been the experience. And I will say across the board, at least for Spectrum, that's our number one goal, is to maintain that both in children and adult services. So yes, Kathy, it is instituted. We are big on our CFTs and that they incorporate the families.
I believe that you have the goal, but do you really have the manpower, the employees to institute all of this? I mean, we know across the board with all the providers, there's that problem, and this is exactly where that kind of thing shows up.
Yeah. Well, and again, I can say as far as the services that we're providing, yes, we do have that. While we will utilize our community resources to provide referrals if we don't have it in-house specifically, we like to keep things in-house for that goal of that continuity of care and that close-knit care team that's all under one integrated service or one EHR. That's the idea and that's the goal. And if that's not possible or the services aren't meeting the need, or we identify a better referral source that can provide that need, that specialty service, we'll move forward with that and then integrate and coordinate care. And when that's not happening, that's not our goals. We want to coordinate and so that doesn't occur. And what I'm hearing is that's still occurring. And I would please advocate in that we're getting other leaders involved to help make sure that that's not occurring. Because I know for myself and the children's director services too, like we want to make sure that the families are owning that treatment plan. They're the ones directing that care. Yes, the resources, or yes, based off assessments, we can provide additional resources or referrals. But at the end of the day, we're not the ones receiving those services. We make it very clear that you're owning your treatment plan, and what we're offering you is what's based off recommendations, and that's an assessment we've had. But if it's something that you're wanting extra supports, you're seeing, like you say, I've heard of FIC, can I please get a referral? We don't want to be standing in the way of that. And I think I can speak for my children's department director counterpart as well, and saying that, yes, we have the manpower, and yes, we want to make sure that we're providing those supports, those resources, and making you feel like you're a part of it. Not, I hate to hear that, again, like most of the chart being read about me, that's horrible. And that's not the direct service that we're wanting to provide in that strengths-based, culturally significant treatment.
So you can share these concerns with the Spectrum Director of Children's Services. Sorry that person isn't here on the panel but it's nice that you're able to represent them. But with your experience as being Director of the Adult Services, how frequently do you see with the adult SMI population folks coming in and saying, I want family support for my my partner, my daughter, my relative, my friend, my people of choice. How often do you see that service being billed and people requesting it?
Not that often. And that's partially where I've come back to my teams and saying, how are we offering this service? Because that's my other question sometimes when I'm reading over assessments. I'm part of the leadership and the licensed credentialed individuals that sign off on assessments and treatment plans. And that's been one portion of something I want to bring back to the table with them. And I have brought back in bigger meetings of how are we offering the service and how are we explaining it, right? It's not just for the client. It could be, again, family support for the natural supports in the client's life. And I think sometimes what we're offering is peer support. I'm going to offer peer support for adults. We're going to make sure they have peer support, and it's branching off into that. Oh, well, they could also offer family support for the people that are involved in their life, the other external people that might need that support while this individual is going through services. I think it's a greater question we need to bring back to the table, and I will for both myself and my counterpart for adults or children's services, and making sure that we're clearly explaining what that service looks like. Because unfortunately, what I've read and part of the services that we're offering from the beginning is I'm wondering, to Kathy's point of it, does it just feel overwhelming when we're saying you should use this, and this based off of what I've heard? I want to give you these referrals and these recommendations. I'm wondering if it's piecing it down and going slower, and this is what this service would do for you. Let's start there. Or it's my recommendation is maybe we explore counseling in the future, but right now, would you be willing to try peer support first or family support first and go from there? It's really good feedback for me to take back to my team, and I'm sure our other health homes and partners in the community as well, if they're listening to this recording.
And of course, NAMI provides family support, and I don't know how much referral is going to NAMI for family support. And I know the years that I've worked in community behavioral health with the adult teams, the more the family knew, the better equipped they were to help and prevent crisis or recidivism and that sort of thing. We do have in the chat, what types of internal auditing quality control methods does Spectrum utilize?
I can speak to that. We have a QM department that completes our own. We mimic what Access and the health plans do. So I can say as on Spectrum side is we do our own at least 20 chart audit monthly and pulling random charts to make sure that they're meeting compliance, but we're also identifying needs and putting through referrals, and that's getting completed. And if that's not completed, we're addressing that with the department and the team that's working with that member to make sure that they are then. So we do have internal quality management measures that are completed monthly at the very least, and then checked in on to make sure that we're completing whatever might be missing or what's identified in those methods.
Do you ever identify through that process training needs?
Yes, 100%. I will speak for myself, and that's usually where I come up with my agendas for my team meetings. It's based off of those measures, because I'm like, oh, we need a referral, or we need a refresher on this kind of referral, or we need a refresher on this service, or I need to re-review this. Because again, as you know, this is a constantly evolving thing, and our teams are always getting thrown new information, and sometimes just need those reminders, or even just kind of a level set in the, hey, can we come back to the basic foundation of the services we're providing? We need this to be strengths-based. We need this to be wraparound care. And so sometimes it's a great reminder for them. And it does usually erupt in more training and conversation, whether it's like, okay, now we've talked about this portion of ongoing care service. What about this portion? Like, for example, I'll be doing a training soon on art meetings and making sure that we're completing all the service offerings and reviews that we need in those. Because again, everybody's around art meetings. Everybody knows how to do that or be a participant in one. But it's good to have ongoing review.
Do you have a parent or family focus group to make your goals efficiently being received? I'm trying to read this. Do you have a parent or family focus group to make your
Make sure goals maybe are efficiently
make sure
being
your
received.
goals are being effectively received?
So that to me sounds a lot like our MFAC groups, so the member and family and adult council. And we have offered those. Our peer support that was in Yavapai County was doing it in person and virtual. And unfortunately, the referrals she got, they weren't attending. So that is something I'm wanting to reinstate as soon as we do have another peer support. But that sounds a lot like our MFAC groups that we were trying to promote as a, and again, you don't have to be receiving peer support or family support to join these groups. It was kind of an open forum of come in, talk to me about what the needs are, talk to me about what the gaps are, or what might be getting in the way. Plan of how we can either have Spectrum advocate for you, or we can include you in conversations to advocate for yourself, and be a voice there. So it sounds a lot like those groups that unfortunately we had little engagement in, but now I'm wondering if it was little engagement or if it wasn't getting to the larger teams. Now, again, they do have to be members or enrolled with Spectrum, so that might have been part of the barriers. We were just looking in-house to the clients receiving services.
I know that with the level of turnover that happens in the behavioral health homes, and the specialty organizations have some degree of that also. The training factor is such that you can do a training, but then these people are gone and someone else is in and they didn't get that training. Some organizations will implement an orientation piece for their new hires to include those trainings based on what is this person's position? Are they on the adult team? Are they on the kid team? And what do they need to know that just doesn't come across through the team meetings?
Yeah, 100%. And again, I can only speak for Spectrum in this, but I know that we have a learning and development specialist that is she did 12 plus years as a family support partner and working specifically with the family and youth services as doing direct support and Meet Me Where I'm At. So she comes with that kind of heart and that passion, and she's developed a really great support services program and training for Spectrum specifically. And we're working on implementing that in our new hire orientation. We have a very extensive 2 to 3 week orientation onboarding where they do get those additional trainings past, like here's your laptop, how do you use it? But also how do you provide family and skill support? How do we provide or manage or navigate our CFT trainings? And that's specific to a actual training that's dictated by one of the health plans we have them go through. So there is a lot of extensive training. And to your point again, Lori, we're constantly saying we should add that to the orientation, right? We should add that to the training track, because there is so much that can't be captured in just those weekly team meetings. There's a lot of foundational work that needs to be maintained from the beginning.
Mm-hmm. Okay. I'm wondering if anyone here who hasn't raised their hand or had a question has an experience with a health home with your own family member, child, or adult. And we can go to that after George, because George has his hand up. Thank you, George.
You're welcome. Karaya, is that right? Thank you. My name is George Gallagher. I'm an advocate here in Maricopa County. But my question comes from listening to what you've shared with us, and I want to sort that out. And the reason being that I've been a consumer for the last 30 years, and with my yearly independent treatment plan, there are certain questions they ask regarding nursing and meds and education, but never once has a case manager offered peer support or even just the existing continuum of care services. Because what I'm hearing today from you all, and that's very good, is that FIC is offered, that it's offered generously when people do their treatment plans or their children and family treatment plan. But at the same time, I'm hearing that, so one, it's offered a lot, but two, you really can't go to a Spectrum health home and expect them to cooperate with you on a self-referral. That's kind of what I'm hearing too. So I'll let you tackle that, please. Thank you.
Thank you, George. For Spectrum Viewpoint, and again, this is me speaking for that. I can't speak for Polaro or Southwest or any of the other health homes or agencies. It is a part of our checklist and requirements of offering peer support and family support at least annually. And again, it's part of our checklist because there are other things that we're offering and making sure are getting into the chart annually, just per that review that's completed. So again, this is great feedback for me to go back and say, hey, how are these conversations looking? Is it getting hidden in the recommendations? Like, hey, here's a list of what we see based off of what you're sharing with us could be helpful for you. So I think that's excellent feedback to make sure the conversation is more than would you like peer support and then move on. That's what I'm hearing could potentially be happening. But it is also really good. I appreciate you sharing. Like, hey, I'm also a consumer. I have not experienced that, so that's something for me to bring back to the team. And then I guess hearing from the other panel members over at the FIC location, it seems like yes, that has been their experience, and that's where I'm hoping to make a change with my teams to really advocate for. Let's make sure we're having a longer conversation than just offering and moving on, and also letting us have them lead the conversation as far as what services they're requesting or they know they want or they have engaged in the past.
Thank you. What I meant to say, if it wasn't clear, is they do not even ask if we want peer support. I've been on a team, we'll call it the purple team. I'm in my purple shirt, and we had a peer support specialist on our team, but it was never offered. Thank you very much. That doesn't fall on you.
Still good feedback. Thank you, George.
So does anyone else have a perspective from your own experience and with a health home, or knowing or not knowing that these services were available?
I think I can share kind of from both sides. So, as someone who's worked for family run organizations and providers for over 20 years, I can tell you that I always feel like family support and peer support in some ways is the biggest well kept secret. The people often say, if I had only known 10 years earlier, if I had only known 5 years earlier, like that's not uncommon. In fact, I rarely get someone who said, wow, I found, family support right at the beginning of my journey and I never had to have any big trouble because I had support right away. I don't hear that very often. And I can tell you that from my own experience, even in the system now with two little ones, having been, vetted, I do this. I know where to go. I have an agency that I've worked with for years professionally and also personally, and still, trying to get family support, trying to get connected, trying to get some of the supports and services you need can be really difficult. What I think the hope is that for things like Trisha's talking about, and I don't know if this, Trisha, occurs throughout the whole state or just only, for you guys in northern Arizona, but the ability for a family to say, hey, I found Family Involvement Center, I found Reach, I found my kid, if I found them and now I can walk in and get support, would make a tremendous difference, I think. But again, like Trisha also said, working with a health home is also pivotal because normally when families do come in, they have children that have some high needs. And so it may not all be able to be done with the family run organization. So I look forward to seeing some of that change over time.
So we've got a fair number of people here on this meeting that are affiliated with NAMI, different various affiliates of NAMI throughout the state. And when there's been recognition of staff shortages and that the clinics can't do it all, no one organization can do it all, and funding is funding issues, whatever. So we made a real big push for including NAMI and referring people to NAMI because they don't have to pay. And I wonder if any of the NAMI folks can speak on what your experience is. Are you seeing people come? And are they saying that they don't know about or anything about the support for family from the clinic? And Krista, your hand is up, so I'll let you go first.
Thank you, Lori. I was going to say, how are we seeing this landscape change, like say in the next 10 years? Because as Terry mentioned, as someone on the panel mentioned, you're talking generations of dysfunction and the consequences thereof that are affecting, the littles as well as adults, and adults are sorry, uh, the transitional age youth, they're going into adult care. But we're also, what I'm experiencing on my side is dementia and other cognitive decline where it needs to be treated separately. And then I know in my family, there are so many, there's ADD, there's ADHD, recent ADHD diagnoses as well as autism and what have you. But you've got like generations of very unhealthy people not in any type of recovery from whether it's substance and or mental health issues, and it's just the burden. It seems like as the woman was speaking from the panel, it's just the frustration and the trying to get be the standalone person who's trying to like manage everything. But how do we see the landscape changing, whether like on the peer support and or on the family support side to help support people who are in this level of dysfunction and no recovery whatsoever. Thank you.
Thank you, Krista. Ralph?
Yeah, with regard to your question about involvement NAMI in this whole problem set, our family support, I'm a family support group leader here in the White Mountains for our NAMI chapter. And speaking from my experience over the past years in dealing with families that come to us where the loved one, is having the issue and the family is struggling with that. I think there's two things that we provide. One, we are a sounding board that operates according to a set of principles and a structure with an agenda and et cetera. So we are not just a typical Valley bullshit session that I experienced with my son in the past before finding NAMI. The second thing that we do, I think, that's so important that NAMI does this everywhere across the country is educate. And so we have the fortunate circumstance of having two qualified and experienced family-to-family teachers that are just completed another class. So anybody who's ever gone through the family-to-family class comes out of it a better person in terms of understanding their situation and dealing with the family, whether it's direct family or an extended family. But one of our current, I would say, missing pieces is we used to run the connection support group. This is for peers. And we lost that capability when COVID hit us. We had two people who were peers who were trained and who ran a connection support group. And that's different than a family support group that I and Maggie and some other people lead. We have aspirations of getting that back again and getting that back on track because it's, again, a structured support group that follows the same kind of sets of principles that are used in the family support group. right now we're missing that piece, and all we can offer is to tell people that there are Zoom support groups for connections at Valley of the Sun and Southern Arizona. So we're not directly in the provider part of things that people have been talking about here. But I guess the one thing that sometimes becomes kind of an obligation, opportunity, whatever you want to characterize it as, sometimes when people come to us in the family support group and they are dealing with our providers here on the mountain, like ChangePoint or COPA or et cetera, and they're going through, let's just say, a phase of seeming to be misunderstood or not getting what they need. There have been opportunities where I personally have tried to help, tried to go to the people that are providing the services and explain what the need is. And, we have some other people that do the same sort of thing for the criminal justice involved people.
So bridge building is an important thing that's going on there.
Yeah.
Thank you, Ralph.
Yeah, Sherry, she was on the call. She knows more than I do.
Yeah. We're getting close to time on this. I'm wondering if any of the panel members would like to say anything in closing to kind of wrap things up. Any ideas for moving forward?
Yes. I just wanted to say that even my grandson, who I adopted and had the issues and still has issues, but we were able to address a lot of them. He's been in counseling almost since the day he was born, 2 years old, I don't know. He's been with his bio mom in counseling because they took the children away. CPS took the children away from my daughter when he was, I believe, about, I don't know, sorry, I lost his age when they started, but since he is very small child, and I've had him for 8 years now, but when he was 6 and he had been in the system, let's say 3 or 4, he said, I want peer support. I don't want to do counseling anymore. It's not helping. He likes it when Jessica comes to the house. She asks him, what would you like addressed? His goals. Thank you. She asks him his goals and allows him to speak. And then she helps him. And he understands, he may not have the words, how much more important it is to have someone there at the house to sort through his goals, what his balls that he's juggling. And that's, I just wanted to let you know that he could see the value over peer support versus having to jump through the hoops. Everything else that's offered is very important to me, peer support. And
That's fantastic.
And being offered the peer support in the beginning would be great.
Yeah.
Because during all the assessments, we've probably gone through 10, 12 assessments, and nobody has ever offered it until I was at the end of all of it. I was like, I don't even know what to do anymore. And then I was offered it.
I think everyone here would agree with you that it needs to be at the front end, and it makes everyone else involved with the treatment teams. The better someone's doing, the easier other people's jobs are. When you can prevent a crisis, when you can provide wraparound support, and the communication between the different organizations involved needs to be strong. It can be beneficial to have guest presenters for your team meetings from the other organizations to help educate and promote services, getting flyers in the lobbies, who's who. Any other closing comments?
I'll just add, attending this has helped me get some more push points, right, for me to bring back to my team. So I just appreciate the perspective and the questions and the clarifications, and it's giving me some ideas of how I need to address some of this with my teams. I know I've asked for it to be added to the beginning, but I'm wondering too, what more conversation and what more resources I need to provide for my teams to make sure that this is being offered from the get-go and throughout, and explained what it could look like. So I just appreciate that, and it's giving me some things to come back to my teams with. So thank you.
Wonderful. Wonderful. Terry, does it give you anything to bring back to your teams at Access?
I have many, many notes. Absolutely. In fact, Susan called me. She must have forgot I was in the meeting. And I texted her and I said, oh, I have so much to tell you. So I really appreciate being here. And like Tricia said, it's a journey. And we're all in it together. And working together is what's going to get us there. And I feel like she does too sometimes, where it's like, oh, this is like we're in the beginning again. But the good news is there are those of us who have the knowledge and others that are coming up with that knowledge, and all together we'll support each other, and we'll support families and individuals who need support. So I appreciate being here.
Well, I think I think I'll turn it over to Kathy to thank the presenters.
Well, thank you, presenters. No, you guys did a phenomenal job educating everyone. And again, the courage it takes to get in front of people. I admire you guys. And I think that we have heard from Kyra. Okay. That
Close
that
enough,
she's gonna
Kathy.
make an impact, and she is going to make some changes. And maybe she'll invite some of you guys over to talk to some of her staff so they get firsthand knowledge about what this means. So thanks, everyone.